Hey everyone, so today I want to talk about cannabis use disorder and antidepressants. So you may or may not have heard of cannabis use disorder before, but basically what that means is that you have an addiction to cannabis. So you're not using cannabis just to treat your medical ailment, you're using cannabis because you're physically addicted to it, and if you don't use cannabis, you're not going to feel well, you're going to be irritable, and you're basically just going to turn into a miserable person. But at the same time, we could say that almost all antidepressants have the exact same effect. So you could easily say that there's cyclic use disorder, or Paxil use disorder, or effexor use disorder. Because when you stop taking any of these medications, you're going to get almost the exact same symptoms. You're going to get a lot of irritability. You're going to fall into a deeper state of depression. You know, a lot of people, when they come off these medications, they report brain zaps. So in fact, a lot of these side effects and withdrawal effects that you get from antidepressants are actually worse than you get from cannabis use. So I'm not saying that cannabis use and the withdrawal effects from antidepressants are the exact same, but they definitely both exist, and we should recognize that. So I think that the term cannabis use disorder has been overused a little bit, because people are actually mostly just using cannabis to treat their medical ailment. And when they're doing that, they're using it as a medicine. Now, if you're someone who's using cannabis every few hours and you're not really treating a medical ailment and you're just using it to make you feel good and to prevent these kind of episodes of irritability, then at that point you could say that you may in fact do have cannabis use disorder. And if this is you, then you need to recognize that, and you need to decrease your overall cannabis use. But my main message to you today is that if we're going to use the term cannabis use disorder, then we should really be using the term antidepressant use disorder as well, because people are getting, like I said, even worse side effects from coming off antidepressants than they are from coming off from cannabis. So I really hope that you enjoyed this video today. I hope you use cannabis as a medicine and not as a crutch, and I'll be back again soon.